Good afternoon. My name is Carl Dwight Demetria, and I am the Chief Medical Informatics Officer of the West Visayas State University Medical Center. So the references for this presentation are the Strategic Planning Workshop held last April 27 to 29, as well as the Management Information Systems Office Mandate and Quality Objectives. So the WVSU Medical Center's vision is a leading healthcare institution responsive to the needs of the community through service, training, and research. The mission of the WVSU Medical Center is as follows. We promote quality, affordable, and accessible healthcare services and wellness programs that cater to the community. We provide excellent and innovative healthcare training, education, and research programs towards prevention and management of disease. We foster the personal and professional growth, productivity, creativity, and teamwork of our human resources. So the strategic goals of the WVSU Medical Center as outlined during the strategic planning last April are as follows. They are broken down into different perspectives. So for the finance perspective, the goal is to increase hospital revenue by 10% at least from baseline. For the customer focused perspective, the WVSU Medical Center must maintain customer satisfaction scores of at least uh, in at least 90% of the respondents of at least 90%. And for the processes perspective, the medical center must develop an effective quality management system. It must integrate IT in its operations. And there should also be programs for patient safety as well as the hospital image and reputation. And the medical center must develop career development programs for technical positions and develop the engagement of its officers and workforce. For the research and extension perspective, the goals of the medical center are to establish a research culture and an extension program, just like a CSR. So the overview of the medical center, it is a university-based teaching training hospital, which is the same as the Philippine General Hospital. It has a capacity of 300 beds, and all major training programs, residency programs are accredited. And it also has complete ancillary facilities such as X-ray, laboratory, um, pulmonary and cardiovascular units, as well as the kidney unit. The medical center also serves as a teaching and training hospital for the College of Medicine and the College of Nursing of the West Visayas State University, as well as other allied medical training institutions located in Iloilo City. It also serves as an end referral center for primary and secondary hospitals in Iloilo and component provinces of Western Visayas, which are Aklan, Antique, and Capiz. So the structure, just briefly, of the Management Information Systems Office, it is under the Office of the Medical Center Chief, and I supervise the operations of the Management Information Systems Office, or the MIS office. The day-to-day operations is handled by an MIS head, and under him would be four MIS staff. There would also be volunteer staff working in our office, as well as on-the-job trainees from different educational institutions in Iloilo City. So the vision of the MIS office is as follows. The Management Information Systems Office seeks to be an important unit of the West Visayas State University Medical Center, enabling the medical center to be more responsive to the needs of the community through meaningful support using information technology. The mission of the MIS office is to support the operations of the West Visayas State University Medical Center with IT software, hardware, and networking. So that is also equivalent to a mandate for our office. The strategic objectives of the MIS office are as follows. Um, we have to ensure that adequate safeguards are in place to protect personal information. Since we are doing system development in-house, we should also ensure that this is rational, comprehensive, and responsive to the needs of its users. As a hard target, we are ensuring that our information systems have at least 95% system uptime and that support tickets that are forwarded to us verbally or via phone are responded to within 15 minutes. And finally, all client computers owned by the medical center must be properly supported by the MIS office. So the strategies of the MIS office in the near term are as follows. First would be an inventory of all resources, including hardware, software, as well as the skills of our personnel. Uh, Also, an emphasis on documentation of all activities of the MIS office, especially since our institution is working towards ISO accreditation. One other strategy would be to resolve any communication gaps, and besides that, rationalization of roles in the office. So, our four staff used to have different disparate roles, but they need to work with each other. So, we need to rationalize the roles in the office. And the last strategy would be to identify skill gaps and recommend any alternative resources if need be. So, for instance, if development is lagging behind based on the needs of the medical center, then we might need to purchase an off-the-shelf information systems uh, to bolster the mandate of the MIS office. So, where are the areas where the MIS office can add value to the medical center? So, we go back to the goals of the WVSU Medical Center. And if we look back at the finance goals, we can support this by improving financial data collection and report generation. As for customer focus, we can also improve customer satisfaction, data collection, and report generation. Um, the integration of IT in all operations is a main value driver for the MIS office. So that's the one that really gives value to the existence of the MIS office in this institution. Um, there's also a need for an electronic human resource information system so that career development plans can be more efficiently delivered. And since we are also looking at the engagement of our employees, an electronically enabled internal client satisfaction survey would help towards that goal. And since we are part of a university, our information systems can help in data collection and aggregation for research purposes. So thank you for listening and good afternoon. And I am welcome for any suggestions or comments. So just leave a comment below. Thank you.